Welcome, everyone. Today, we are going to talk about a concerning phenomenon whereby staff members in nursing homes and assisted living residences use social media platforms in ways that violate privacy rights and also includes actual mistreatment of residents in those care settings. My name is Eilon Caspi. I'm a gerontologist, and I've been in the aging field for 30 years. I started as a nurse aide in a nursing home where my grandfather lived. And I worked as a social worker in nursing homes, a consultant, researcher, author, and care advocate. And what I wanted to say is that over the past 15 years, I conducted various research studies on different forms of elder mistreatment in long-term care homes. And whether it's abuse, neglect, resident-to-resident incidents, financial exploitation, theft of opioid pain medications, residents' fear of retaliation and actual retaliation. And this is my latest project on the misuse of social media in mostly in nursing homes, but also assisted living residences. So before I go into the substance, I just want to recognize the Nursing Home Inspect website of ProPublica that have a very powerful website where you can conduct searches for completed investigation reports in nursing homes nationwide, over 15,000 nursing homes. And recently, they upgraded the search features substantially, which makes our ability to detect investigation reports in a much more efficient way and save a lot of time. I know it based on my personal experience using this wonderful search platform. When you do use this platform, make sure to use what they call the advanced report search, as opposed to the single keyword search feature. And that can help you. If you know the phenomenon really well, then you should know some of the main keywords that will enable you to identify those investigation reports of your interest. So kind of reviewing this phenomenon and over the past several weeks, I've came across a number of statements made by whether it's residents, family members, care advocacy organizations, even care providers and other stakeholders, describing the phenomenon in the following ways: an emergent threat, a new type of mistreatment. These acts were described as cruel, disturbing, appalling, disgusting, and it represents violation of the human dignity of the residents. And in some cases, they are outright crimes. We have to recognize a very important and groundbreaking work done by ProPublica, again, on this issue. In 2015, they published a report with 36 cases, very concerning cases of, again, privacy violations and mistreatment, where staff take and post, whether it's photos or videos of residents in compromised situations, a lot of residents that were naked, whether it's in the bathroom or in bed, with humiliating captions describing those residents or the situations as they're sharing it with their colleagues, friends, family, and others on different social media platforms. Very, very concerning. The sources, and in some cases, there were actual abuse, verbal and physical abuse of residents that they posted online. The data sources for this project were government inspection reports, court cases, and media reports. And if you want to read each one of those, the subsets of the 36 were expanded to 47 back then. If you want to read an abstract, so to speak, of each of those incidents, you can read it in this link. And I want to give you a few examples from that project. In New Jersey, a nursing assistant photographed a resident's private parts and sent the picture to a friend who uploaded it to Facebook. In New York, a nurse took photos of a resident who had incontinence, and again of the private parts that were covered with fecal matter, and shared them with another staff member on Snapchat. In California, police were notified after a video was posted on Instagram showing an employee bending his rear end over the resident's head and expelling gas over the resident's face. The resident told state inspectors that this happened often. In Illinois, a staff member recorded another staff member using a nylon strap to lightly slap the face of a 97-year-old resident with dementia. The video was posted on Snapchat. On the video, the resident could be heard crying out, don't, as the employees laughed. In Indiana, a nurse assistant did something that I've seen in other cases where there's really, after they're doing these egregious acts of dehumanizing residents, they perceive those acts in a way that are dismissive and devaluating the experience of the victims, downplaying them. In this case, the nursing assistant pleaded guilty for sharing a photo of the resident's butt on Snapchat, and the nurse aide said, they just blew everything out of proportion. It was just a picture of her butt. How many people take a picture of people's butts? I worked in healthcare for 5 years. Everybody takes pictures of the residents all the time. I am not the only one. And a follow-up publication by ProPublica on NPR came out the following year, 2016, to gauge what agencies are doing to address this concerning phenomenon. Margaret Collins was 91 years old, and she lived with dementia. Staff knew that she really doesn't like hospital gowns. So they took hospital gowns and threw them at her to taunt her, to harass her. They put it on video and posted on Snapchat and put a caption on the video, Margaret hates gowns, with those demeaning emojis. Her daughter said, this is somebody's sick idea of entertainment. Margaret no longer lived at the nursing home, but her family says that she still has nightmares about the incident. And I think this brings up an issue that we don't discuss often, the long-term trauma of abuse of older adults. So a few years ago, an older woman in Minnesota, her opioid pain medications were stolen from her by a nurse who came to her home over a few months period. Eventually, he was caught. She suffered excruciating physical pain for a long time. And her daughter told me that years later, her mother is still terrified that this RN will come to the new assisted living in which she, to a different care setting. She moved from the community to assisted living, and she's still terrified that he will come and harm her. So I think we need a discussion also about the long-term trauma. Most situations we see in the media or even in research, they only capture the short-term consequences, if at all. In this case, the family is suing the care home for $1 million in damages. And we'll see how this case ends up. Even the American Healthcare Association, that has thousands of nursing homes and assisted living members of this organization acknowledge 8 years ago, the nursing homes are all struggling with this issue. There's also indications, not surprising, as with other cases of elder mistreatment. There is an attorney in Massachusetts that suspects that such incidents are underreported, in part because many of the victims have dementia and do not realize what has happened. We will return to this issue of the heightened vulnerability of individuals living with cognitive impairment in the specific context of this form of elder mistreatment we're discussing today. So moving on to describe this project that I led. The data for the project consisted of 100 state surveys and complaint investigation reports. The vast majority, that is 97 of them, were from nursing homes and 3 from assisted living residences. Those investigations came from 31 states across the nation, and they were completed between March 2017 and August 2023, this year. So fairly recent. I also want to mention that I've compiled electronic archive with all these 100 investigation reports in PDF format that are available upon request, whether it's for researchers, whether it's for media reporters, care advocacy organizations, anyone who is interested in this concerning issue. I also want to mention that I have a summary table with a very high level, very brief description of each of those 100 investigation reports, which I'm happy to also make available, and we may post it on Elder Voice Advocates webpage that will be dedicated to this webinar. So I'm not going to go into detail here, but I wanted to make sure that you can see the breakdown of the states, those 31 states where these incidents occurred. In terms of the findings of this project, there were 148 victims of these acts, and 85% of those victims had some level of cognitive impairment. At least 1/3 had somewhere between moderate to severe cognitive impairment, and it's probably significantly higher because in many cases, the actual level of cognitive impairment has not been reported in the investigations. So again, people living with dementia are known to be at high risk of different forms of mistreatment, and this phenomenon is not including in this with regards to this phenomenon. So the breakdown of the social media platforms out of the 100 investigations, and 40 of them, just the words social media were appearing. And then the top one was Snapchat. Again, there's some consistency here with Snapchat, as was the case with the ProPublica earlier reports that I described a few minutes ago. But it was also on Facebook, Instagram, TikTok, FaceTime, and other platforms. I want to give some brief descriptions of specific incidents from this project. And when I use an asterisk, it indicates that the resident, the victim, had severe cognitive impairment. In 16 investigations, residents were shown with adult dependents or naked on photos and videos. In one incident, staff were laughing in a mocking tone while the residents with cognitive impairment with the butt exposed on the floor. A blind resident with dementia, naked with bowel movement, an aide sent a photo to her mother. Again, this resident had severe cognitive impairment. One resident was shown to have feces up and down the leg And the caption by the staff member, "This is how my morning is, shitty." In other cases, staff were dancing provocatively, twerking in residents' faces. In other cases, they were singing explicit lyrics of vulgar and offensive music. In another incident, staff tickled the nose of a resident with Alzheimer's disease, severe cognitive impairment, while the resident was asleep. In another disturbing case, staff were wiggling the loose skin of the arm of a resident with Alzheimer's. They did it repeatedly. And the caption, "Don't leave your family members with her. She plays with their skin." In another incident, a resident with dementia was held down and given what is called the wet willies, that is a finger with saliva in the ear. This is a resident with severe cognitive impairment and probably with very limited ability, if at all, to protect themselves. In another concerning incident, a resident was shown to wear a staff were wearing the wig of a resident with dementia without permission. In another incident, staff pulled the wig of a resident with dementia and hit her on the head with the wig. A resident was shown with hair extensions placed on them. Another resident was wearing a fake eyelashes while asleep on video. In this case, staff altered a resident's nose to a piggy face and posted the video. And in another incident, staff were encouraging a resident with dementia to use a vape pen, and the video included laughing emojis. In other cases, there were derogatory comments and making fun of residents. There were photos meant to humiliate and dehumanize 10 residents with dementia in a single nursing home, many of them with severe cognitive impairment. A resident with cognitive impairment was shown in bed. The caption, "Grown-ass man acting like a baby." In another case, a resident who was described as suffering from morbid obesity, staff put a commentary on the image, "The fattest person on earth!" exclamation point. In another incident, there was a video caption saying that the resident wants her or his dead husband to take him or her home. Again, a resident with severe cognitive impairment. And in another incident, staff were scolding a resident with Alzheimer's for tucking hands under a waistband of his or her pants. In this case, the video showed 3 residents watching TV with the caption, "Old pervs," with a green vomiting emoji face. Another video in another nursing home had the caption typed up by a staff member, "I am high as fuck arguing with these niggers." In another disturbing case, staff members pretended to be funeral home staff while laughing. They were telling the resident, or putting a caption, telling a resident, I believe, "We have a cardboard coffins." I mean, the level of cruelty, I mean, it's hard to process this. A resident on a wheelchair is shown in an image with the caption, this is an old resident, "Happy birthday, just turned 21," and then saying something demeaning about the resident. And then there was offensive sexual remarks in another nursing home, wanting to do abusive sexual things to the resident. In another case, resident was shown wedged between chairs. The photo caption, "This motherfucker." And again, the resident has severe cognitive impairment. Another photo caption about a resident with Alzheimer's, typed up by a staff member. This little shit just pulled the fire alarm, and now I had to call 911. Woohoo! In another nursing home, a resident with dementia was taunted with a baby doll. The video was shared at a high school basketball game. And the last example here, a photo showing a private part of a resident with dementia with a heart emoji overlaid on it. It's hard not to get emotional about what we just heard. Even, I went through these incidents multiple times, and it's still hard to believe that, staff members who are entrusted to provide dignified, caring, compassionate, safe care to vulnerable and frail individuals will do that. Moving on to the section about some of the things we may want to consider as we collectively try to prevent and address this phenomenon. So care homes must raise awareness among all employees to residents' rights in this context, preventive measures and reporting requirements. When I say all employees, I mean all direct and indirect staff members. That is not just CNAs in nursing homes and nurse aides, but also housekeeping staff, dietary aides, maintenance staff, front desk staff, because oftentimes they are the ones who come in regular contact with residents. They could be detecting it and critical reporters, but some of them may engage in these incidents as well. So we must make sure that providers provide extensive and ongoing education to staff managers, residents, and their families. They must implement a zero tolerance policy, and the serious consequences for perpetrators must be clear to all prior to the first minute that any employee works in the care home. There must be policies and procedures that are strict and that are strongly enforced internally. As a lawyer said, care homes need to enforce their rules, not just have them. And care homes need to institute a policy whereby they ban personal cell phone use during care work shift, with some rare exceptions. We can discuss this if you want. There's some misconceptions about this phenomena among staff members. Some employees think that the photo or the video, the demeaning photo or the abusive photo, or the photo that violates the privacy rights of residents will disappear, will no longer exist within seconds or a couple of minutes, or once the intended receiver sees them. But guess what? Receivers can take a screenshot and the image can then have a life of its own. In fact, Snapchat on their website recognize this scenario. Individuals could also take a photo of the screen using another device. And another thing that people may not know is that a photo or video that was deleted may still live on a server and could be discoverable in court of law. And in several cases in my project, it was the co-workers or friends or family members or even community members who saw it may report it. So this is a call for action for CMS to strengthen their oversight and enforcement of this form of mistreatment. And several years ago, CMS came out with a memo specifically on this issue, in summer of 2016. And the title is Protecting Residents' Privacy and Prohibiting Mental Abuse Related to Photographs and Audio, Video recordings by nursing home staff. I wish we had similar guidance to surveyors in assisted living residences, where nearly 1 million people live, with 40 to 50% of residents have dementia, and 7 out of 10 nationally have some level of cognitive impairment. And mental abuse actually relevant here, and oftentimes it is the case whereby mental abuse includes taking or using photographs or recordings in a way that demean or humiliate a resident. And the federal nursing home regulations have a state survey deficiency FTAG F600, which is the right to be free from abuse and neglect, which includes mental abuse. I also want to highlight F607, FTAG 607, which is the requirement for nursing homes to develop and implement abuse and neglect policies. There's also F609, where they're required to report allegations of violations pertaining to potential abuse, neglect, and exploitation. They must report it according to very specific timelines and to specific agencies such as the State Survey Agency and law enforcement. I also want to highlight F608, which is reporting reasonable suspicion of a crime, because in the subset of these incidents, there were actual crimes. And this requirement, federal requirement in nursing homes, requires specific individuals to report any reasonable suspicion of a crime against a resident. And a covered individual is defined as an owner, operator, employee, manager, agent, or a contract in the care setting. And the reports must be submitted to at least one law enforcement agency and the state survey agency. Nursing homes should have policies and processes to comply with this law. And there are also strong protections for whistleblowers that are lawfully report a reasonable suspicion of a crime, which could apply to these crimes in the context of social media, misuse of social media. F503 in nursing homes, the right for privacy and confidentiality of records. Residents have a right to personal privacy of their physical body, but also personal space. That's another misconception. You know, staff members say, "Oh, but I only took a picture of their bed or their nightstand or a personal belonging," or but that's not relevant, because the private space, the furnishing, is also included in this requirement. And if the resident didn't provide a written consent, an informed consent, or if the resident is not cognitively able to do it, their legally authorized representative, oftentimes the family member, must provide written consent to do it. And so even what could be perceived as harmless by staff members could be perceived by staff members as harmless situations. Oh, all I did is I took a picture of a resident in the dining room, or a resident participating in a group activity. Well, guess what? This was done without informed consent. It's a violation of privacy. And it also, there were situations where social events, a Christmas event was posted without residents' consent. In one case, there was a panoramic picture of residents in the main area. And guess what? There was a medical chart right behind it. And that was a violation of the residents' right to have their medical records protected. So it goes well beyond what staff may perceive as violation, and therefore we need a comprehensive, ongoing staff education program on this issue. And we have to, of course, mention the HIPAA Federal Act, which is the federal patient privacy law that carries civil and criminal penalties. And the United States Department of Health and Human Services has the Office of Civil Rights that can enforce privacy laws such as HIPAA. So it's another vehicle whereby we can hold perpetrators and providers accountable for these acts. I want to mention the role of some other agencies and trade associations. Of course, the long-term care ombudsman program needs to increase training among the ombudsman staff and volunteers that are going into those care homes. They could also inform residents and their families about their rights in this context and their options for addressing these concerns. I believe that the National Ombudsman Reporting Center also needs to track this phenomenon if they're not doing it so far, so we have a better sense of the scope of complaints nationwide in both nursing homes and assisted living residences. And we must make sure that perpetrators, whether it's a nurse aide or a nurse, will be reported to the nurse aide registry, especially in cases where it was abuse or a gross violation of privacy that was intentional to humiliate and demean an individual. So they won't just be fired and cross the street, so to speak, and start working in another care home and mistreat other residents in similar ways. We need to see law enforcement involved much more and taking a bigger role here. We're going to talk in a minute about their collaboration with social media platforms, but they need to be more aware of this issue and take a more proactive action to address it. An Attorney General in states and medical fraud control units can take initiatives on this issue, investigating and prosecuting these issues. District attorneys, the U.S. Department of Justice and their elder justice task forces, care advocacy organizations such as Elder Voice Advocates are hosting this webinar, can help raise awareness, as we're doing today, to this phenomenon, as well as other care advocacy organizations such as the Long-Term Care Community Coalition in New York City and the National Consumer Voice for Quality Long-Term Care and other care advocacy organizations. And of course, we need to ask ourselves what trade associations, the long-term care trade associations for nursing home and assisted living are doing to be on top of it, to raise awareness, to be proactive, to make sure there's strong guidelines in place to prevent, detect, report, investigate thoroughly and in a timely manner, and to report according to state and federal requirements to appropriate agencies, whether it's state service agencies or law enforcement. And as of 2016, the Assistant Attorney General said that we have not yet brought any cases involving violations of nursing home employees misusing social media or electronic devices to record residents in compromising positions. We wholeheartedly agree that such conduct is deeply troubling and unacceptable. So one has to, we need to kind of check what has been done by this agency since to address this emerging and concerning phenomenon. As the use of social media is literally exploding with new social media platforms and increased use internationally and in our country. And a New York Attorney General stated in 2015, we will not tolerate professionals who abuse and exploit the trust of nursing residents by broadcasting private and sensitive medical issues on social media. And I should say that they are taking action. I just don't know the scope of that action relative to actual incidents that are taking place. And as I mentioned earlier, there's got to be a way to hold social media platforms accountable. Many of them are very, very profitable, and we must make sure that their actions are effective in preventing, deterring, carefully monitoring in a timely manner, and referring concerning incidents to law enforcement. How can we increase collaboration with law enforcement agencies? And yes, Snapchat, Facebook, TikTok have safety centers and safety advisory boards and community standards, but to what extent they are effective in addressing this phenomenon? That's an open empirical question. It is also important to mention that CMS recognizes that some residents in nursing homes are afraid that staff members will retaliate against them through the use of social media. And this is a quote from CMS. Several residents stated that they were afraid to ask for staff assistance for the need to use the bathroom because they were afraid that staff will retaliate against them by posting, whether it's photos or videos of them on social media. They also stated that when they were receiving care, if staff pulled out a cell phone, they didn't know if staff were taking or posting pictures of them. So this issue is a major issue. It's very common. I know that a lot of staff members are still using cell phones during their work shifts, and many of them are using it through their work shift. And even if they're not even taking a photo of a resident during their shift, the fact that they're holding it, say, for example, during personal care, during bathing, or changing of adult depends in the bed, this could be perceived as a threat for residents. So we need to consider that as well. And in this context, I want to mention that recently the Long-Term Care Community Coalition funded a large project that I led on residents' fear of staff and managers' retaliation in nursing homes in many states. And based on my study, they published a report, They Make You Pay, Our Fear of Retaliation Silences Residents in America's Nursing Homes. And I'm happy to share that a couple of weeks ago, my article was accepted for publication in the Journal of Applied Gerontology. It will be published in the coming weeks in this journal with additional detail about my study. There was also a USA Today article about it and a webinar hosted by the Long-Term Care Community Coalition. So thank you, Richard, Eric, and Haley for your incredible support of this project and a tremendous amount of work that went into creating this impactful report. Related to it, we must remember that a lot of staff members fear retaliation by coworkers, supervisors, and managers, as I demonstrated in another follow-up project that I did that was reported by Elder Voice Advocates in a webinar that I gave, and also in my report, detailed report, and an industry report in the McKnight's Long-Term Care News. And I think it's an opportunity to highlight the urgent need to conduct a research study on family fear of retaliation in long-term care homes, which is probably common and very concerning and harmful. I think that there's an urgent need to develop guidelines for care providers, staff members, managers, administrators, owners, but also for residents and staff and their family members. Here's one example of such guideline to nurses in the use of social media and healthcare systems. It was created by the National Council of State Boards of Nursing, but much more is needed. In closing, I want to say that residents have a right to be free from privacy violations and mistreatment through staff misuse of social media in long-term care homes.